Overjet has been, first of all, an amazing diagnostic tool. We've implemented this technology for doctors who typically will, walk into a room, we'll look at an X-ray, we'll look at photographs, we'll look at all the periodontal charting, and we'll put a plan together. What Overjet has essentially done for us is added an extra tool that allows us to not only see things differently with the color coding that it uses, but it actually helps us communicate what is on the X-ray much more clearly with our patients. So our patients are now more engaged in the traditional gray, black, white radiographs that we've used, and now they can actually see what is truly happening. They can see something from a doctor's perspective.
I've been a dental hygienist for almost 20 years now, and Overjet has been a great addition to our practice. It's very simple to use. When you are in the patient's chart, you can click on the individual X-rays, and it has all of the information off to the right side. It lets you know decay that is present. It also lets you know calculus that is present and the bone level of the patient. It's good for not only restorative diagnosis, but also periodontal diagnosis.
Overjet's made my job easier on many fronts. Number one, streamlined exams. Number two, bringing and rallying my team around the data. And three, giving us tools even before we start the day. So one of the cool things that Overjet does is it has this dashboard that allows us to see all the patients on the schedule before we even come, so to start the day. Any X-ray that was on the patient's chart in the past can be screened through Overjet. It's almost like having it seen by 1,000 doctors. The same image, it's like you're getting a consensus of 1,000 doctors on this X-ray in the moment, in real time, play out, right at your fingertips, which is so incredibly validating for us.
We've always had dental X-rays, but when it's highlighted in different colors and it is actually pointing out the little difference in the grayscale, they can actually see it for themselves. It makes a big difference. We have actually found the treatment acceptance has gone up since we've had the software, and I think that it is a visual thing.
If we can see things early, it's always better. If we can communicate things early, it's always better. And so that is how overall we can help our panel of patients. It allows me to deliver, the higher level of accuracy, and I just think now it has become so integral in what I do every day that I think it's one of those technologies that you can't live without.